then one of the things that we had heard was that without school being up and running, that kind of took away the avenue where a lot of complaints that would normally go to CPS were routed. When kids show up to school with bruises or anything, and they want to tell a teacher, they want to tell a nurse, and then from the school setting is where CPS gets a lot of complaints. And then because of the COVID, I'm assuming they weren't going around and doing the
active investigation.
Yeah.
PCOR 1. Mm-hmm.
And so we're bringing on a DYA director, Melanie Brennan. Sorry for the delay, Melanie. I don't want to make you late on your first day.
Thank you. Yeah, I was having trouble with my camera anyway, so we got that squared away.
Nice.
Good morning.
Good morning. So I don't know if it was just me, but the lieutenant governor in the last couple weeks of interviews had kind of alluded to some issues at CPS, but I didn't know it was at the state of emergency level. And it kind of came out of the blue, I think, not just for me, but for a lot of people who maybe weren't in on the process. So can you give us a little background on that? What led to this declaration?
Well, I think that, you all know that Public Health and Social Services has been at the forefront of fighting this pandemic. And so they've had to reallocate staff to help at the immunization clinics. I mean, since day one. Public Health also had to help other agencies, like, for example, the Department of Youth Affairs set up our infectious control program at the start since March. We had Shima coming out, checking on us, checking on the kids, as well as when we had our outbreak. And so I think with regard to naming DYA as administrative custodian is basically because we are a youth serving agency and we are poised to help with any backlog in referrals. A lot of the agencies were challenged. I mean, we were knocked to our knees. We didn't know, like, okay, do we come in, initially as an essential organization, we run a 24/7 youth correctional facility. So for me as the director is like, no, you guys have to come in, you're essential. But getting a clarification, because the pandemic, this was the first time we ever had to deal with it. So all the agencies had question on who's essential, who's coming in. And so, we had to get clarification on all those issues. With regard to any backlog of referrals and referral management with CPS, I guess that's why, they're sending DYA in. There have been issues with recruitment of CPS workers for as long as I can remember. Even when I was a CPS worker, the turnover rate is so high. The work is so hard on an individual. You bring that home, it's not just 8 to 5. You bring home that stuff with you at the end of the night. And it can be grueling and very upsetting. And so I understand the critical nature of CPS. I understand that they have been overwhelmed for years, and the pandemic just brought about other challenges. And so we do have some designated social workers that will be detailed to assist in the investigation of referrals, those that are backlogged and those that are coming in. And again, this administration, the governor and the lieutenant governor wanted to get ahead of this. We're opening schools, and we know that aside from the community and aside from hospitals and clinics, most of the referrals from CPS do come from the schools. And so this is important work, and we're ready to help public health, address it.
You said backlog of cases. How many cases are we talking about?
Today will be my first day to actually go in there. I know that the backlog is being addressed by the Deputy Director, Terry Uggan, but I guess I'll find out more information on those cases and those numbers later on today.
Do you know how many cases there are then?
Well, I only know that, in FY20, they received over 1,000 referrals. And so, of course, the referrals don't stop because of the pandemic. So how many they addressed, how many were vetted, I'm not quite sure.
And how many staff, I guess you were mentioning the social workers, how many are actually over at Public Health or at CPS?
So are you talking about CPS staff or my staff that I'm bringing
CPS
with?
CPS staff.
I believe that CPS, the Bureau of Social Services, has about 30 staff, but not all of them are dedicated to investigation and crisis intervention. So that is another thing that we'll probably have to manage when I get there.
But do you have an idea how many are involved in active investigations?
No, not at this time.
Okay. So priority number one, once you, I guess, get on the line with Perry, I believe you said.
Terry, priority number one is really referral management. Looking at the crisis intervention and making and ensuring that the referrals are acted upon, and we are following the mandate of the law, which is they must be investigated within 72 hours. That's very clear in the law.
And it's only temporary. Do you have, were you had any discussions with the governor on how long CPS might be under your jurisdiction?
Now, I think that I would need to go in there to have a better, I guess, be better able to assess how long I think that we'll be there. Of course, I'm going to help them with recruitment. I'll follow up with, DOA. I've already spoken to Carol Hinkle Sanchez, and she's willing to retrain. And sometimes that's real critical, especially when you have new people and you have a high turnover rate. That training is really important. And so, and also, sitting with the supervisors that are currently there and talking to them about, what their needs are. And as soon as I get in and have an opportunity to meet with everyone, I think I'll have a better time frame.
Well, when you hear about CPS, it's a huge, major responsibility. How are you going to be able to balance both, being the director of DYA and overseeing this critical agency, CPS?
That was one of my concerns. We're really trying to stand up some programs for our kids at the Department of Youth Affairs. And I know that we had spoken very recently about our reentry program. And so, of course, I voiced my concerns about just that issue. And again, we're all collaborating to help get this program rolling. And so the Guam State Clearinghouse has decided to help us, or they volunteered. They said, okay, if you're going to do this, then we'll help you with the grant. And so I think that's what one of the challenges of this pandemic was. We've all had to learn how to be more collaborative, and no single agency can do anything alone. I mean, it's such a tough time, but we've had to virtually do everything and work with everyone. And so I think, the Department of Youth Affairs is best aligned to help CPS right now. And like you said, it is so critical. It's so important that these referrals not linger and that they're acted upon for the safety of, kids. And so this has to be my priority. And as you know, I've always talked about, dually involved kids that are involved with both the child welfare system and the justice system. They have the most complex needs. And so I think that, it's not self-serving for me to do it, because I'm going to go into CPS, and these are some of the families that we eventually will work with. And if I can somehow prevent it and get them the services they need when they enter the system, the child welfare system, then, it is kind of a feeder to the juvenile justice system. So, it's going to serve us as well.
Mm-hmm. You mentioned you worked at CPS before?
Yes, I started my career actually in Gov Guam as a child protective services worker, and then I later moved to the adult protective services world before going into the court system as a probation officer.
Mm-hmm. Well, go ahead.
I know it's early on, but are we going to be able to get our hands on the numbers of children who have been abused or placed in situations that they can't get out of because of this declaration with CPS? Is that going to be kind of one of the things that you look at?
I'm sorry, I didn't understand your question. Are we going to get?
I'm just wondering how many kids are really affected by this. I mean, kids who are being abused and haven't got the time of day from CPS because of this pandemic.
Well, I'm sure the numbers will be clarified. And remember, many of them are allegations, and it's not necessarily that they are, but the law does mandate that they are acted upon within 72 hours. And so that is my goal. And if referral management was an issue, then I'm there to help. So I think, the answer to your question is yes, I will get some clarification on numbers. But that is exactly why, the governor and lieutenant governor put it there, so that we can manage it better, so that we can, see what issues there are and how they can be addressed.
Would these numbers also show that when a complaint was filed and the child was returned back to that alleged abusive home, and then another complaint was filed?
I do believe that they keep those stats.
Okay.
I gotta ask the elephant question: is why did it take so long for us to realize that all of this was going on? I mean, we're how many months into this? 9 months. I lost track already.
Since March.
Yeah, basically since March, right? And we've only heard this being mentioned by the lieutenant governor within the last couple of weeks. So, how did this get by the administration and the senators and whoever?
Well, Chris, again, I was a child protective services worker myself. There have always been issues with recruiting personnel that want to actually do this job. And then once you recruit them, providing them with the training and just, retention the turnover rate is crazy ridiculous. Like when I got involved in December, when we were trying to understand this issue, I was told that, we lost 2 social workers. One, I think as early as 2 weeks ago from CPS, another supervisor is contemplating retirement. And so succession planning, I think, is an issue, with all of GovQuant, but specifics to, what has been happening with CPS, I'm not sure. And I think that's why I'm going in to assist with that question and to assure the community that, we're trying to get in front of it. But it has always been a tough job. CPS is such an important agency, but throughout the years, not this administration, but even in previous administrations, there has always been an outcry for, we need to do better. And I think that's, why I'm going in, why I've been asked to go in.
Mm-hmm.
What about the money? So doesn't the emergency declaration come with $250,000? Is that going to be used to hire like more staff or?
So, as to the specifics of the funding, that was something, again, that I needed to meet with the administration about. This is my first day, guys, so I'll have more answers for you later. But yeah, certainly those are all issues, and I know it's important, and we're trying to be transparent, and I will help you find the answers to all your questions.
Thank you, Melanie.
But it's a daunting task. But we're ready to get in there and roll up our sleeves and work towards, being better at what we do.
When did you find out that you were going to be taking over jurisdiction of CPS?
In terms of like taking over, in terms of the executive order, they had given me notice in December that we had, at least it was disclosed to the Department of Youth Affairs that there were some issues, and that in what ways could we help, and they were even soliciting like, who has experience with child protective services. And as it happens, there are many of us within the Department of Youth Affairs that had actually started out and then moved to other jobs. So it was they had asked about it since December, but the Child Protection Act really prohibits anybody else from coming in, and so they needed to find a manner, a mechanism, and the executive order did that, allowed us to come in, so long as we're detailed specifically to CPS, because you can't be having your social workers doing DYA work and crisis work at the same time.
By any chance, have you heard if there's been elderly abuse?
That's a different. That is a different section. Again, that's adult protective services, and that is handled by the Division of Senior Citizens. Is there elderly abuse on Guam? Yes, there is. How is it addressed? Right. They have, a counter counterpart
Mhm.
agency for the elderly and for disabled adults.
Yeah, I'm just asking because I'm wondering if we're going to see a similar action
Right.
with adult protective services, not just child protective services, especially considering that adult protective services is also under
Public health.
public health,
Right.
and they're
I don't know the answer to that. I mean, that is a question to be asked.
yeah.
Right. Melanie, thank you. Are you good?
Yeah.
Okay.
Thank
Appreciate
you.
it.
Good
Right
luck
on.
today.
Okay.
Good luck. Have
I
a
have-
great first
Thank you
day.
so much. But I actually have one more thing.
Please.
I know that Child Protective Services has always had trouble with placement, and so I want to put it out there that if anybody is interested in fostering a kid in need, please call 475-2653. We need more foster homes. We need more suitable placements for kids who are in crisis, for families who are in crisis. So again, 475-2653. Thank you.
Thank you, Melanie.
Any update on the Regalu Foundation, the foster home?
Just the only update, because of course that's one of the first things I asked, is DPW is still waiting on a part for, I believe it's a valve for a water pipe. And I spoke with Vince Ariola, it still is not in.
Okay. But 475-2653, that's the number to call if you are interested in being a foster parent.
Right.
Thank you so much.
Thank
Have
you,
a good day,
Melanie.
guys.
Yeah.
Take care.
Have a great day. Break a leg.
Good job.
Melanie Brennan, DYA, and the CPS.